Hello and welcome to my presentation. In random controlled trials, the number needed to treat will be derived from the results of a treatment and interpret the number of patients who are needing the treatment to prevent one additional event. It measures how effective a treatment may be and whether there are benefits or harm. Randomized control studies are most often used to evaluate the effectiveness and safety of a treatment. RCTs are used to experiment and conduct research on interventions to determine any cause or effect. Systematic error such as bias, limited generalizability, and random error are some shortcomings of an RCT. To ensure that proper application of design and analysis proves sufficient results and conclusions to answer the medical problem. Planning of appropriate criteria, randomization of groups, and the sample size are important to aid us in detecting important effects and associations of the intervention. The results of an RCT can be interpreted to guide clinical decisions, like is this treatment worthy of use? One of the most useful ways to measure these interventions is to express the probability of a bad outcome, such as participants with the disease, as an absolute measure using ARR, absolute risk reduction. These are binary outcomes such as hospitalization versus not, death versus survival. Here we have an example of an RCT from Venezuela 2019, effectiveness and safety of olive oil preparation for topical use in pressure ulcer prevention. The outcome variable is pressure ulcer incidence, and the study goal was to test if a new topical preparation, which is olive oil, is as effective as hyperoxygenated fatty acid for preventing pressure ulcers in nursing home residents. Table 2 shows the participants from each group, experimental and control group in column 1 and 2. A pressure ulcer incidence has been calculated as an absolute risk reduction between the two treatment groups. It is the amount of patients needed to be treated for a particular time frame, which was 30 days, to achieve an extra patient with an effective response to the treatment. We can calculate these NNT numbers with the ones given to equal 42 whole participants. The precision of this value is seen in the confidence interval, which has an upper range and lower range. As a clinician, we can critically appraise this information to determine that the NTT is valid before integrating it into practice. Absolute measures are widely used and express the efficacy of an intervention to help guide us, but these numbers should not be taken in isolation, as they measure the outcomes for each particular study and not a particular therapy. In summary, RCTs can give us high-quality data to aid us in clinical decisions. It is a very straightforward investigation of cause and effect relationships. These trial studies should be critically appraised and valid before making a decision. The number needed to treat is an effective measure in expressing patient numbers, but not always reflective of the usefulness of a particular treatment or therapy. Thank you.